Hi, colleagues. I hope you are doing well. And there are two stories today. The fox, there was a fox that was running across the forest. It crossed the borders, went to the nearby village. A dhobi had created a small pond with a blue dye chemical in it so that he can dye the cloths in blue color. The fox unfortunately fell into this well. The entire fox became blue in color, but it was very different. It was not looking like a fox. It came back to the forest. While it was coming back, the smaller animals used to give a salute saying that it's a new animal. And this new animal proclaimed itself to be the king of the forest. And it said, God has sent me to take care of all of you. There is nothing called the lion is the king of the forest. And I have come here today. Everyone has to listen to me. So, because of its unique color difference, they have not seen something like that in the past. So, the entire animals agreed to it, and it was acting like a king for a few days. On fine day, it was heavy rain, and then the blue color was gone, and they came to know that it is the normal fox, and they all pounced on it and they killed the fox. I hope you know the story, right? So it's something similar to a new course like Pharm D getting introduced into the system, and we are all like behaving like we are the kings of the forest, thinking that there is no doctor who is the king of the healthcare system as of today. So we want to find out mistakes, we want to find out issues, we want to find out what are all is happening which are not as per the requirements of the healthcare system, and we are like superman superwoman. We are like the fox that has come to correct and take care of the healthcare forest here. When we start practicing really, the rain day will come and our colors will be gone. If I'm sorry, it's not for everyone. If you are not prepared with all your skill sets, the basics of all the medical knowledge, the pathophysiology, the pharmacotherapy, how to use the softwares and find out the drug interactions and provide solutions to the doctor, right? If you can provide solution to the problems, then you are a welcome person. If you don't provide solution, just keep finding and pinpointing the mistakes, you are not required in the system. So as a pharm D, you are there as a solution provider. Please try to understand it, not just a person who does some drama like the blue fox. But unfortunately, I am seeing many of us run behind the title doctor, which we put in front of the Pharm D. The way people are telling us inside the college and other things that you are Doctor Pharmacy, Doctor Pharmacy, Doctor Pharmacy, and so you have come here to find out. Including the staff, certain places, it has become a practice to say that Pharm D has come to correct the medical system as if something is going wrong. Please, it is not correcting the medical system. Wherever errors are there, the errors have to be rectified, and that happens in every system which is ongoing. Even once there are records that the pharmacists have done mistakes and patients have died, right? So let us not say that we are behave like we are superman or superwoman to come into the system and correct the entire thing. This is one story. Now we have to understand we are not that kind of a blue fox. Number one. Number two, there was a donkey which the dhobi could not feed, and so the dhobi one day from the forest, he got the skin of a dead tiger, and the dhobi had given that skin on the donkey's body, saying that if you go with the skin, you are going to eat very coolly from the other farmers lands and other things, thinking that you are a tiger, nobody will tell you anything. The nearby land, the farmer was there, and there were a huge amount of cucumbers and other things. The donkey loved it, and it went every day. It had a stomach full of thing, and the donkey became huge and huge and huge and huge. Now, one fine day, after eating all this, in its own voice, it started singing very happily because the tummy was full, all those things. So he came to know that it's not a tiger and it's a donkey, and he came with a bamboo stick and broke its legs. So this is what happens when we act as if we know everything, or when we try to pretend like a tiger and do the tiger's job, but actually we are a donkey, right? So when we claim that the cat and the tiger belong to the same family, because they have stripes, a cat do not become a tiger, right? We have to understand the difference. The attitude, the skills, the knowledge which is required for a particular post is required so that you can sustain in it and you can perform in it and you can give the expected output of what your Form D is going to give as. Now, one situation, if you are the person who is having a hospital, or if you are a person who is having a pharmaceutical company, or you are a person who is heading a clinical trial company, it's your own investment. Please tell me frankly, whom will you recruit out of the three persons I am going to tell you now? There are three scenarios. Like one scenario where there are three people coming to you. First person has got the certificate of Form D. Second person do not have the certificate of Form D, but he knows what is a clinical trial, how to do things. He has done a diploma in clinical trial. He is a life science graduate and all those things. The third person is a Form D person who has done a clinical trial course and he is aware of what it is, right? So here, a Form D person with just a certificate, not aware. The second person, a life science guy who is aware of what is clinical trial with the certificate course on clinical trial. A third person, a Form D person who is certified by Form D, certified with clinical trial, aware and he has the real knowledge, attitude, and skills of what he needs to know as a Form D or as a clinical trial specialist. Who will you recruit? First person, because he has just a Form D certificate and no idea of what is clinical trial. The second person, who is a life science graduate who knows clinical trial. The third person, who is a Form D, who is a person who has got a certificate on clinical trials and who knows what is clinical trial. So anybody's first choice, if you are the investor, it is going to be this guy. And the next is going to be the second person because he knows what it is, whether he has a certificate or not. Now, the third person who has a certificate, the Form D, since he feels that he has a certificate and he is qualified, he may be qualified for the interview but not for the job. So, there is no career ahead for career, for growth, for future, for earning money, to do something different and to really be result oriented in the industry. You will have to contribute to the healthcare system, and contribution can start only when you have acquired the real knowledge and skills. So just a certificate is not going to help us. Don't be the blue colored fox which has dyed itself because of dyeing with blue color, or don't be the donkey which is having the skin of a tiger. If you think just Form D is enough, you are absolutely wrong. The certificate is not just enough, it has to be here. Thank you.